Actually, for the muscle strength, I would explain that even deeper because people's definitions of muscle strength or rest, like all these definitions are a little bit convoluted based on, how they're thinking of it. So I would be like, well, what really is strength? Well, taking it back another step, I'd be like, well, your muscles aren't strong enough around your back. Then I'd explain really what strong is. What is strength actually? What are we even talking about? So, in my frame of mind, how I know this now and explain it to patients, I'm talking about the tensile forces of how much force your muscles like this band can tolerate. So, the strength of this band is how far I can pull it without it snapping. Kind of similar with the muscles, except the muscles have electrical signals that also influence how strong or not it could be. So strength is the tensile force of the muscle and the neurologic input with how much force your muscle tissue or tendons or whatever can handle. So then I explain that kind of to the patient, and I'm like, well, does that make sense? Yeah, that makes sense. So now your muscles around your back aren't holding enough tension with enough electrical activity to support you when you're walking around or lifting or playing football or jumping to dunk a basketball. Oh, okay. So then I'm like, oh, so now when we go do these small or big exercises, you know what I'm talking about. We're trying to get you stronger, not just stronger, like whatever this, yeah, whatever is in their mind, this ethereal, magical word of strong. What does that mean? And we can do the same thing with mobility. Well, we have to get your back more mobile. Well, what does that mean? Well, maybe sometimes their back muscles are like this or like this. Maybe we have to find a happy medium so the back muscles can pull and lengthen appropriately for you to be mobile appropriately without injury. Because if we're mobile like this, that's not good. If we're mobile like this and just trying to be mobile, that can cause injury too. So we need your strength and mobility to be appropriate so that you can decrease this back pain when you're moving and all that stuff. So going back to your classmate's question about rest, well, if we're resting, we're not getting this appropriate tension length or the nervous system signal to the muscles to get you strong enough and mobile enough to not cause re-injury going forward. Then I'd ask them and get them kind of into the conversation and be like, well, does that make sense? And does rest do any of this that I just talked about? Oh, no, not really. So that is, of course, within this specific back pain scenario. And like you were alluding to, sometimes we do need